love running. Thank you. I'm so pleased to be part of this panel today, presenting on a participatory action research project in Ontario that asks the question, how can emergency departments provide better care to people who use drugs? And this project is a collaboration between researchers at U of T, including myself, and the Ontario Network of People Who Use Drugs, who are the ones who identified the need for this research. No conflicts. So this project has 3 core objectives: to better understand the emergency care experiences of people who use drugs, to develop some training tools for healthcare professionals around trauma-informed care, and ultimately to carry out this project in a way that supports and increases the capacities of people who use drugs to do their own research. So this was a participatory and qualitative study, and we did it in 4 different towns and cities in Ontario, centered around 4 emergency departments. And over 6 months, we conducted semi-structured interviews and surveys with a total of 51 people who use drugs about their recent experiences at the hospitals in their communities. And these were conducted by research assistants from the communities who we hired and trained to do the work. You didn't have to have research experience to be part of it. We gave you a 12-week training. You were an employee at U of T, and you got a certificate at the end. And we, at the same time, did 42 interviews with healthcare providers. And then we did thematic and narrative analysis. So I'm just quickly going to share what we've learned about stigma and barriers to emergency medical care. So how are patients identified and labeled as drug users was a big question in this work. Patients attributed their poor care to being identified as a drug user, but how did this happen? So providers told us that patients were often identified as drug users during the triage process, including through information available in electronic medical records. So stuff like previous overdoses or the prescriptions they had could kind of flag someone as a drug user or drug seeking. And patients emphasized, though, that obviously race and income mattered in how they were viewed and treated as a drug user. And what happened when people were identified as a drug user? While it could be medically important to disclose drug use, we found that being labeled as a drug user or drug seeking could result in patients being deemed lower priority during triage, being withheld or provided inadequate pain management due to perceptions of drug seeking, diagnostic and treatment overshadowing, so not properly investigating the presenting medical issue and focusing on substance use, and overall just patients talked about experiencing stigmatizing, dehumanizing, and coercive care. So where are we going from here? We are working with OnPut and with our RAs to develop training materials, which we know will be such a small drop in the bucket of what needs to change. But we're having important conversations with the emergency departments about other things that need to happen to really have structural change to reduce care inequities. So I think I did that quick enough, hopefully. But I want to conclude by thanking our funder and everyone who is part of this project, especially the 51 people who shared their stories and the Ontario Network of People Who Use Drugs. I encourage you to learn more about them through the QR codes here. Thank you.
Thank you.
Thank you very much. Don't leave. Let us say what we felt up here. Look, this research, again, is going to be very useful for us who advocate not only that peers should be at every stage helping and translate between the 2 realities of the medical people and or the police, and the people who use drugs, but also for what you mentioned, dehumanization and stigmatizing. You saw it in the research. We feel it every day. If you write person who uses drugs, drug users, you know that you'll be the last in the clinic, especially if you're a woman, of course. And personally, I would love to read the stories very much, as well as the results. As Alexei said, the questions will come in the end, so thank you very much.
Thank you.